Good afternoon, everybody. Thank you so much for having me here today to present at the pitch session. My name is Shama Patel. I'm a neonatologist and clinical informaticist at Nationwide Children's Hospital and The Ohio State University in Columbus, Ohio. What if I told you that one of the greatest untapped resources in neonatal care isn't a new piece of technology? It's not a new mode of ventilation, it's not a fancy new laryngoscope, and it's not a new prediction model. What if I told you that it's the humble progress note? Let me tell you a little bit more about why I think that standardizing progress note documentation in the NICU can revolutionize neonatal care and research. First, a quick detour. From my introduction, you may be wondering, what exactly is a clinical informaticist? Since the 1960s, technology has slowly been making its way into healthcare settings. In the last 2 decades, spurred forward by legislation mandating the implementation of electronic health record systems, there was an urgent and pressing need for a very specific role, a clinical informaticist. Someone whose expertise lies in the implementation, maintenance, and improvement of electronic health record systems with the lens of a clinician. Through the efforts of many, in 2013, the first group of board-certified clinical informaticists received their certifications, sponsored by the American Board of Preventative Medicine. In the last decade since then, 2,800 physicians have become board-certified in clinical informatics, and I am proud to count myself amongst their ranks. So imagine this. It's the weekend. You're coming in to take care of a patient that you've never met before. You log into the EMR. You're visually overwhelmed by a note that requires so much scrolling. You just want to understand the patient. So you click over to take a look at the labs, a quick scroll there. You click over to the vital signs, the medications. Click, click, click. We spend so much time trying to understand our patients, sifting through cluttered notes, lost in a sea of auto-populated templates and unclear expectations. We receive so much training and education for every single aspect of our jobs, from how to evaluate patients, how to do a physical exam, how to interpret lab values, how to deliver bad news. And yet the thing that we spend all day doing, interacting with the EMR, we receive almost no training at all. And certainly not the level of individualized, specialty-specific education that would be required to utilize such a complex tool in such a critical environment. I believe that EMR workflows and documentation workflows should be thought of like procedural guidance. Although there may be some nuances between how you or I approach intubation or umbilical line placement, the final result should be almost exactly the same. Similarly, documentation workflows should be driven by agreed-upon standards and not impacted or dominated by any one individual's stylistic preferences. As the data has shown that decreased variation in patient care can improve patient outcomes, I think there could be similar benefits that could emerge in the alignment of our clinical and documentation workflows. Okay, so what's the pitch? Consider what we could achieve if all neonatologists taking care of all babies everywhere could agree on one standard for how we communicate the care that we are providing in a written format. I am surrounded by so many of you with incredible skills in the newest technologies of today: large language models, natural language processing, and predictive analytics. Imagine what we could learn about our patients if all of our notes had the same form and structure. Maybe in the days leading up to a positive blood culture or a diagnosis of NEC, we're all saying the same thing about them. We have the technology today for this incredible state, but we have a responsibility as those generating this input to ensure that it is timely, accurate, up-to-date, and structured meaningfully. I am the first person to say that we can't let our documentation and data collection needs to supersede what is clinically expedient. The purpose of our daily documentation is to serve as a clinical communication tool, one that is looked to by many people, whether it's other covering or consulting physicians, nurses, allied health professionals, billers, coders, researchers, and now even families themselves. The most important thing here is for us to all come together and decide what this standard is. I know that some of you in here are thinking, well, AI is going to write my note anyway. And you are absolutely right. And if we don't teach it the right way, nothing is going to get better. Many of us lament our demotion to data entry specialists in the era of the electronic medical record. But my contention has always been that your interactions with the EMR and your relationship are determined by your role. In the same way that many different people come and contribute to the care of our patients on rounds, their relationship to the patient is what defines their role. In that same way, a neonatologist's interactions with the EMR are unique, just as our contribution is to the care of the patient. So what are some concrete steps forward? So first is instituting a standardized progress note template, one that pre-populates with basic patient information, but only includes active problems and the daily decision-making for that day. The second is to develop a patient summary screen that allows for quick review of patient information, allowing necessary information to be directly viewable, but it liberates the progress note from being that review area. This is just an example of the one that I've built for us to use at Nationwide. And third, moving all historical patient information not immediately pertinent to current care out of the daily plan and into the hospital course. Being a good doctor in 2024 means learning how you can use an EMR to serve your patients better. But I think more importantly, it's how we can serve ourselves better. If you take a moment to think about what the EMR has made possible, it's remarkable. Lab results are viewable almost instantaneously. Imaging results are at our fingertips. We can securely communicate with each other, sometimes inside of our EMRs. Notes can almost write themselves. The secret sauce here is not a fancy template or a complex EMR build. It's coming together as a community and defining what that standard is. Luckily for us, this work was actually done decades ago by Dr. Lawrence Weed. In the same paper where he described the now ubiquitous SOAP note, he also describes the mechanics of a problem-oriented medical record. And today, we have the tools that you need for that to be a reality. So I leave you all with my dream, which is that one day, every baby and every NICU everywhere will have a progress note that looks exactly identical. Thank you.